running the same date as June 2nd, 2026. Present with us is, health board. This case is Pam Hannah. Pam, do you want to lead us on what's going on in your department, the health department, please?
Sure. I actually had a couple weeks off for vacation, which was nice. And so kind of trying to catch up now and get reacclimated. Erin also took a week off last week. She had family in town for graduation. So we're trying to get into that season where people are taking vacation, and we kind of covered for them, which gives us an opportunity to kind of refresh ourselves on everyone else's work. One of the things I asked for in staff meeting today was for our school nurse to do some epi training with our epi nurse so that she could take care of some of the communicable disease cases during the summer, just to kind of refresh and help. So they're working on that, because what we see in the summer is that foodborne illnesses and sexually transmitted infections kind of raise a little bit. May was our first month we had no COVID or flu to report, so that's good. It looks like our respiratory season is calming down. We did have an RSV case in May, but it looks like we're starting to settle down on all of the respiratory things. Did have a foodborne illness last week, and we had two sexually transmitted diseases last week too. So we're kind of shifting gears a little, and we'll do a little other investigative work. Our tuberculosis patient is in good shape. That TB was imported from another place. It didn't start locally. We did all the investigations needed and have done all the treatments needed for everybody that's been involved in that. I'm still not sure whether the state has made a final payment for housing.
We haven't got anything.
I'm gonna check with our clerk and today, you know, they're busy.
Yeah.
But I will check with her and see if we can pay for that out of the public health budget, so we can get that done, and then they can reimburse us to our budget so that we can get that paid for and done. I am focusing on budget this week. I know we have to get those turned in, and I have been gone, so that's my primary focus this week. I know there's been some concern over the master contract with the state, which is the umbrella for all of our task orders for our other grants that come through the state. And I'm not sure if there's been any updates on that. I will be in a meeting this afternoon with some state partners, so hopefully I'll get some clarification on where we're going with that. But I know all of our task orders have been slow to come in, because I think there's some hold up with that master contract. And we only sign that every, I don't know, 6-7 years. I know I haven't signed one since I've been in this position. So this is the first one that's come through since I've been the supervisor. We did get additional immunization money. Dan signed this, Commissioner Hagerty signed this last week. So we do have an additional funding for immunization that I'm going to look at how we can use that. We're considering that would be a good funding source for a new vaccine refrigerator and freezer for the building expansion that we're doing, because that is something that we'd like to do. When we do that expansion, is to upgrade our refrigerator. The refrigerator is actually having some issues, and we have a separate refrigerator and freezer as we have to if we have just standard ones. If we get an actual immunization unit, then we can have them in one, just because we have to monitor both the frozen and the refrigerated temperatures separately, and standard models don't do that, so we have to have 2 units. So I think that's where we're probably going to use some of this extra task order money for that. Anything that's left over, I can roll over into salary for next year for my immunization staff, which is probably what I'll do. And so those have been the big things on our plate right now. In our staff meeting today, we also, did some final preparations for Clancy Days. Last year, I had all of my staff take, incident command structure for ICS, 300. So on onboarding, all of our staff does ICS 100, 200, and 700 so that we have the basics for incident command in case there's an emergency that we are responding to. We realized during the pandemic that even though we used incident command, there were some gaps in our understanding and knowledge of why and how we use that. So I had our whole staff last year do ICS 300. And then since then, we've been using that command structure to plan all of our events. So we're using that to plan Fancy Days, Frontier Days, and the fair. And then we've also done it for immunization clinics. So it just gives us some familiarity with it in a non-emergent situation. It also allows us to rotate through the positions and roles so that we have some familiarity with that. Because we're doing that, this week on Thursday, we have our FEP workshop, which goes over our FEP task order for this coming fiscal year. And we've been asked to present what we're doing with that for the state at that meeting, at that workshop, because they liked the idea of using it that way for practice, and it is one of our deliverables for that grant. So Jesse is the incident commander for Clancy Days, and I'm operations, Tana's logistics, Aaron's communication, and Molly's finance. So for Frontier Days, we'll rotate those roles. The reason Jesse and I are IC and operations is because we're still keep covering that clinic. Molly and Tana will cover Frontier Days, so they'll probably move into those other positions to do that. So, so those are big things on our plate right now. Schools are out or pretty much out, so the school nurse will be doing some daycare reviews now, and like I said, kind of doing some backup with communicable disease to do a little cross training there. We will have a caravan event this summer where we collaborate with the local clinics. They do sports physicals for the kids, and we do immunization. So it's a great community thing. Caravan, Blue Cross, Blue Shield, and the Caring Foundation pay for all of that. And then they donate the money back to the school.
When is that? August?
What's that?
Is that August?
In August, yeah. We haven't done it in Whitehall yet. They haven't agreed to do that, but last year I talked with Logan Reif, and she's their office manager, and she was pretty interested. So I'm gonna start working with them to see if maybe we can do it both here and there this year, and that would be good. So
that's for sports physicals and immunizations?
So the clinical providers do like sports physicals for the kids, and then we review their immunization records, make sure they're up to date and compliant for school requirements. So it's a great time, to look at that.
Okay.
So I think those are some of the big things. I am having a meeting with Carrie Pride about pathways this afternoon to see what to do with that grant. I have gotten behind on some of those deliverables with the things that we've had going on. And so we're going to make a plan for what to do with that. So FYI,
Good.
they don't want me to give up the contract. I don't know. Not so sure I don't want to. So anyway, do you have any questions for me or concerns or?
We're working on getting a realtor to help us through the buy sell on the building, just so you're aware of that. We're right now
Right.
getting her all the information she needs to plug into a buy sell. Once we get that in order, then we'll have everybody review it before we sign it. But then once that buy sell is done, then we can go into the closing of the building, and then we should be good.
And then I assume next steps would be to bring in an architect to talk with us about needs.
Yep. Yep, we gotta figure out how to do that. If we can do some kind of a design build, sometimes that's more efficient where the contractor helps design it and builds it at the same time. We kind of did that with Ginger's building, the last building we built, and it worked pretty well, because you don't have three people you're working with, you only have you and the
Right.
contractor that you're working
Right.
with instead of that.
And do you have to like put out an RFP for bids, and is that what you have to do?
I think you
now?
probably would for a design build, so. I don't know how many contractors do a design build, but we'll talk about it when we get to that point.
Figure it out.
If we want to do that, or if we just want to have it architecturally designed first and then put it out for bid. But the only problem with that is then the contractor sometimes has problems with that architectural
Right.
design, and then you've got that.
Right.
But we'll figure it out once we get the documentation done to actually own the building, and we can move forward after that.
Well, I would like to bring the medical side in too, to talk with what their
Yeah.
needs are, so that we can look at everything all at once.
I think that'd be a great idea, yeah.
And see where they're at. They are having a little bit of restructuring over there. Intermountain has let some staff go.
Oh, okay.
So their RN won't be working there anymore. And I don't know whether it's gonna affect any of their providers or not, but they're having some
Some changes.
some personnel changes, so I don't know what that'll do for them.
Yeah, hopefully this building thing will give us a little more opportunity to have a little more communication with them. I don't know if you communicated with them now.
Yeah, we have I mean, part of the reason I like to be there is because it gives us really a great collaborative partnership with them.
Yep.
And, in fact, they don't buy and store vaccine. They send everybody to us. Because it's easy for them to walk up the hall. There's a lot of work to vaccine storage and handling. And so, that's a really good thing. And, with this communicable disease that we've just been, it's been really nice to have them right next door for that partnership. So,
Yeah. Great.
there are a lot of advantages to having them next door. So we like it.
Good. Yeah, it's a good setup for sure.
Yeah.
Commissioner Doolittle's reported quite a bit all the time when we have our commissioner meetings, but is there anything new or anything you can add in terms of the mental health side?
So we are working on doing an update on our community health improvement plan. And I think at our events, these summer events, we're gonna have some sort of a display to kind of show what we've done. A lot of the work we've done with the community health improvement plan has been on that mental health priority, because we've been using the Nurture initiative to accomplish some of those strategies and objectives there. We do have one of the things we've really been looking at with the system change with the near-term initiative funding for behavioral health improvement is how do we kind of switch this to a positive community norm? Kind of take some of the stigma away from mental health, take some of the negative feelings and ideas away, so that we're looking at a positive view and building a positive community outlook on it. And so one of the things we're really looking at is hope. And we've been researching hope, and hope is measurable and it is teachable. So we have Dr. Julia Garcia, who's written the 5 Steps of Hope, which is based on the science of hope that's been studied for about 20 years. She's coming in August to do a training. So she'll train up to 50 people in our community, and we're looking at cross-section, we're looking at mental health and medical healthcare providers. We're looking at educators. We're looking at law enforcement, first responders, public health people, businesses, faith leaders, anybody that we can get as a cross section to come in, because then those 50 people will be trained to be trainers. So that's part of what we're doing with sustainability, is trying to build our local resources to continue to do this outreach. So we're really excited about that. I just got notification that she accepted and she's coming August 6th. So we can pay for her out of the near-term initiative funding, but Rochelle is actually looking at another grant to pay for that. And that would, leave our grant funding for other things. So we'll pay for her out of the grant now. And then if we get the other grant, we'll reimburse our budget with that. Rochelle, I had dedicated 20 hours a week for Rochelle, and she's using about half of that. So that funding will last longer to keep her position open. So that I'm happy about too. We do have a task order report due at the end of this month for that grant. So we're looking at, one of the deliverables we have to do is we have to do a strategic plan for next year, what we're going to be doing. And we're doing a behavioral health improvement plan for the deliverables for their communication plan and their sustainability plan. So we're just building it right into our community health improvement plan we've already done, and making an addendum to that with what we're doing with the behavioral health improvement piece of that, rather than doing a whole other plan. We're just building on what we have. And that's really our strategy on a lot of this, is looking at what's already happening in the community, what we can build on, what we can get partnership in. The other thing that we are looking at is how can we use the opioid settlement funds, because it can be used for prevention. So we're kind of looking at that. I've had a couple of conversations with Steve about some ideas there. Marijuana tax and alcohol tax can also be used for behavioral health and prevention work. So there's some ways that we can maybe keep this ball rolling in the future if we're smart and if we're kind of looking at it ahead of the game. So that's where we're going.
Sounds great. Thank you.
Yeah. Yeah, we've had some good involvement with law enforcement in our crisis subcommittee for the mental health LAC. And Rochelle is working with our youth. So we've got a youth mental health LAC group, subcommittee group too. So Craig has been working with Rochelle and LaDana to look at the bylaws for that mental health LAC, so that we can kind of, really be efficient in how we're using that group to move this work forward. So we've got a lot going on.
Yes, you do.
Yeah.
Right direction.
Place. Good people that are helping. So
Commissioner Doolittle, you got anything?
I don't, just I appreciate everything you're doing, Pam. Sounds like you're busy.
thanks, Commissioner Doolittle. We are busy and happy. That's good.
That's always a plus.
Yeah. There's a smile on our faces, so that's good. Well, thank you.
Thank you, appreciate it. Thanks for coming in. We will be adjourned.
You guys want to hang out for a few minutes and you can listen to what Kelly has to say, and
Absolutely.